Hi, my name is Shikha. Today, me and Wrongly going to present a project which is based on using traffic light signals for fall prevention during hospitalization. And I'm going to discuss the initial part of the project, which are project overview, strength-based nursing objectives related to this project, and objectives and milestones. So talking about project overview, the first I would like to talk about fall. A fall is defined as an event which is results in a person coming to rest accidentally on the ground or floor or other lower level. It's a major public health issues worldwide. According to WHO, falls are the second leading cause of unintentional injury deaths worldwide. Almost one third of people above 65 years old will fall one or more times in a year. They happen in community and in hospitals. So, according to Australian Institute of Health and Welfare, it's estimated that more than 40,000 falls were recorded between years 2017 to 2018 across hospitals in Australia. Out of 30% of patients who fall in the hospital has some kind of injury leading to increased length of stay in the hospital, which leads to significantly raised healthcare cost and comorbidity. The motivation for choosing this project are that the traffic light signals are a simple way to communicate patients' false risk. They have been used before in various settings, and they are bright in colored, visible, and easy to identify the signs by anyone. The strength-based nursing principle closely related to this project is a collaborative partnership, which means partnering between patient and the stakeholders to achieve patient's goals. Similarly, this project is about partnering patients with the project team members and other medical staff involved in the patient care, such as physiotherapists, nurses, and patient family members to achieve patient-centered goal of fall prevention. The other strength-based nursing value close to this project is to promote health and healing. And the aim is to promote safe mobility by preventing falls and improve overall functional independence. Now I'm going to talk about milestones. It's on chronological order. So first one was choosing project and title with the group members. Second, obtaining permission for project implementation. Then communicating the project details within the involved group and staff members. After that, creation of traffic light signals and placing them on the right place. Then supervision and collection of data at regular intervals. And obtaining feedback at the end of the project. And lastly, reflection on the project, how it was done, what could have improved, such a thing. Now I'm going to talk about objectives, more about objectives. The primary objective of the project is reduce falls by the way of using traffic light signals in the form of brightly colored and appropriate size like red, yellow, and green labels in highly visible areas. And each symbol indicated the false risk severity and the assistance required. There are two secondary objectives. First is to improve communication between patient and stakeholders. in their care. Second is to minimize patient and family awareness and to improve confidence with their emulation. And project was implemented in one ward over a period of 1 month using traffic light signals on the sample of size 20 patients. Monthly false data for the ward was obtained from RISC-MAN system, and false rate for the project months was compared with the previous month, like how was the previous record. And one fall was recorded less in the month using traffic light signals, so the primary objectives was made. We used form to collect feedbacks, and it was obtained from patients and involved hospital staff on 2 occasions. Both secondary objectives were met with overall positive response of improved communication as reported by patient and the ward staffs. And patient involved in the projects also reported more confidence with their emulation using signals, which was a positive outcome of the project.
Hello, my name is RONG. I'm with SHIKHA. We're doing the traffic light symbol for prevention during hospitalization, which is start August to October. That's spending 2 times. So I would like to talk about 3 parts of this project: is issues and feedback and summary experience. For the issues side, we find some problems, some issues during the program. So first of all, we noticed that the full data when collected from the RISC-MAN program, which is the computer programs in the hospital, for those people had accident or some issues, we need to put it on RISC-MAN to find out the reason and then to meet the outcome. So that's a program. So we always use to put the full accident on. So we noticed that maybe it's not accurate because someone maybe missed enter the full accident through the RISC-MAN program. So we can't get the accurate data from that. And also we noticed that for the patients who are suffering cognitive impairment, it's like hearing and sight impairment, so they can't totally understand what's the traffic light symbol meaning displayed in their bedroom. So we need to explain that very clearly for them. And we still can't guarantee they can understand. Especially some elderly people, they got a short memory loss. They can't remember what's that, so they might forget it. So this is some part we need to improve in the future. And we also noticed some issues like lack of communication between healthcare providers. It's like physiotherapists, if they came to do the assessed patient mobile status, if they didn't update on the whiteboard immediately after this assessed, so nurse may get misunderstanding. And also for those people, those patients admitted in the night or weekend, they do not have physiotherapist around. So we only can, according to the previous mobile status, to set up their mobility level. So that is also some issues. So we need to concern about this in future as well. And we now ask some nurses about this program, and nurses still rely on the handover. As for handover communication, they will keep asking the handover time, and rather than to watching the traffic light symbol on the whiteboard. I just thought this might be the easy way for nurse to know it, and for the new program, as a nurse, if you like them to accept the change, it may need take time. But also, if some of the nurses they they are not sure, so they will go to check the whiteboard. We still use the whiteboard, the traffic light symbol on the whiteboard or the progress notes as the main part of recognize the patient status, the mobile status. And due to the current issues, the COVID-19, so family members can't come in to see the patients, so we can't communicate with family members, discuss the patient's mobile status, because we noticed that also the majority of the falls happened upon discharge or before admission to hospital. So this is also the part we need to get involved when the restriction released. And the next part we think about the feedback and the closures. So we got the positive feedback because the COVID-19 restrictions, so we can't get too many response from the feedback from the patients or even the relatives. So we only had 20 feedback surveys from the staff, allied health, and the patients. 90% feedback are satisfied, and only 10% of feedback felt no change or unsatisfied. That is due to didn't update the traffic light symbol on the board immediately, and also patient get the color blind, they can't see, or patient had the cognitive impairment, they can't totally understand what's that meaning. So we try to make the explanation simple to understand. This is we are going to do in the future. Because we only have one word to involve to do the survey, and also not enough feedback, we saw that, but we might do the furthermore about this. But compare with the previous, the fall rate in the past 2 months, in the 2 months in the last year, so we can notice that it's the less fall happened and the fall rate goes down. So that's meaning this project is useful, but just need time to see this significantly improvement. And for the experience of summary, we will continue the positive experience, and we will just avoid and minimize the negative experience. The positive experience, we noticed that we got very effective supported teamwork, and we had improved our abilities to project strategy, and we got planning, and we do the milestones according to stamp by stamp, and we get feedback, and we do the report. So this is very good teamwork. We work together. And in the future, I think we just discussed it. We think about put the traffic light symbol wristband with patient. Just put with the patient ID band together. So when we check the ID band, so we can remind us that's easily to see, and also you won't forget it. If you are not the one look after this patient, if you saw this patient in the corridor, you throw the wristband color so you can recognize what the mobility level this patient is, so what kind of assistance the patient need to receive. 2 months is not enough, but we try our best to do this project, and we continue in the future about this. We will put the good experience to the future and avoid